please help spread the message of frequency-specific microcurrent by clicking on the like button. You can subscribe to us on YouTube or any podcast app. If you have any questions, please leave them in the comments. You can find the podcast transcription at frequencyspecific.com, as well as more information about frequency-specific microcurrent.
Hi.
We're back.
Did you get some sleep?
Yes, not as much as my 3 days of no sleep, but I'm getting caught up slowly.
Getting caught up. We get to talk about that, right?
Yes, I would like to share that because for so many reasons, I was grateful to have the knowledge for all the scary stories that we share. There's a reason why we share the scary stories.
Yeah, I thought you might want to say something about that.
Yeah, we can jump right into it if you want. I know you always have lots of stories. Saturday morning, my daughter woke up, my 14-year-old daughter woke up with, which looked like bursitis, acute bursitis. And for hockey players, olecranon bursitis is very common. There's not a lot of padding, as we all know, on the olecranon. It doesn't take much to traumatize that little bursa. She had no pain. She played a hockey game Saturday, and we taped her up and thought, whatever. Saturday, late afternoon, evening, she started to not feel well. She had chills, which is not like her. She's my kid that runs hot all the time. And then Sunday morning, she woke up with I think I sent you the picture, a very scary looking red, I don't want to say rash, but presentation on the elbow. So the big acute inflammatory bursa was gone. Her arm was very swollen and had this very angry looking red.
Diffuse.
Yes.
Red.
Yes.
And for me, when you showed me the picture,
yeah,
the only reason I knew what that was as soon as I saw it was the red flag pictures that David Musnick has in the core. Red flag, this rash. And that looks like a little rash. How bad could that be? So that's how I knew that it was scary.
Yep. And so we went right to urgent care, and I chose the urgent care near us that had labs and imaging there. And it was so funny because the urgent care doc came in and saw her elbow, and his eyes got really big. And he says, okay, good call for bringing her here, but you have two choices. You can go to this hospital or you can go to that hospital, but you have to go to one of those, and you have to go to those right now. And I will call ahead and let you know that you're coming. And I'm like,
okay.
So trying to be super calm, my daughter's, what's going on?
My elbow, what's that thing?
She felt totally fine, although it felt very hot to her. So people who are listening and watching, if you're putting your diagnoses together, we could play a little game and you could throw it out in the chat what you think it is. And I know it's hard for not seeing it, but obviously they were concerned of an infection. So we went to the hospital of choice and triaged and got her in right away. I have nothing but good things to say about UCSF. That's the hospital that we chose. Within minutes, we had an orthopedic team in there. We also had the pediatric team in there. And between the two of them, figuring out versus the acute bursitis versus the presentation of cellulitis, how to treat, what to do, did x-rays. Orthopedic was like, it could be soft tissue, so just the cellulitis, or he was worried that the infection could have been further already progressed into the bone. So imaging was required, labs. So what's that?
I like these people.
They were, like I said, I can't say enough good things about the facility. Thank you, UCSF Children's Hospital, Oakland, for taking such great care of us for 3 days. We got home last night. So it was intravenous antibiotics pushed every 8 hours and labs taken every day to make sure inflammatory markers were coming down, white blood cell counts were going back up again, down. And of course, I didn't sleep. No, and that's normal for a mom. And it's also because of the scary stories that we hear and talk about. That was one thing I got across the board from the orthopedic team was good job recognizing that as fast as you did, because this gets ugly very quickly.
Yeah, it's just a hop, skip, and a jump from cellulitis to sepsis.
Right.
And to recognize it that quickly, I'm for everybody that makes it through this, the last half of the core on Sunday afternoon, I pause on the cellulitis
Right.
slides.
And I can give you new slides now to show the stages of
Yes.
cellulitis and how quickly it responds when it's in the right hands.
Yeah.
So yeah, thank you to Dr. Musnick for that slide, all of the talks that we give on these things, and also just listening to your inner voice, the little bird on your shoulder that says, this is bad.
Or I know this isn't not bad,
Yes.
right? It doesn't look like this. There is nothing orthopedic that looks like this. So whatever it is not orthopedic and is bad.
One of the questions was, did they wash it out? There is no open wound. There is nothing. She didn't even have a hangnail. So when we were talking about how did she get this infection, it doesn't have to be from an open wound. It comes right through the skin. And the orthopedics team says it loves olecranon bursitis. That bursa gets traumatized and all the bacteria are like, yes, let's go right to that joint. So it's very common, apparently, with olecranon bursitis.
And the other thing I know about cellulitis is there's a source someplace. So
Right.
I had a colleague or a friend who got cellulitis in the middle of his tib anterior. Just no breakage of the skin,
Yeah.
no scrape in the skin. It's just all of a sudden he's got this raised lump and this red rash. And I said, Michael, what tooth do you have infected? This one. So the next step for her is a 3D cone beam just to make sure, because cellulitis doesn't come from space.
So I will say that hockey players have disgusting pads. They don't get washed and disinfected hardly at all. And they're thrown on the floor of disgusting locker rooms. Staph is very prevalent in locker rooms and in gyms. It seems to be the perfect storm. We do, like I said, we see this with hockey players a ton just because it's just foul.
Okay.
So this was a big reminder to all the teenagers that we know in our family to hang up your gear and spray it with something and disinfect it. You are not immune just because you're a teenager or a young adult.
The skin barrier should keep the infection out.
Right.
Why didn't it? What's her vitamin D levels?
Yeah. So then I had 3 days watching my daughter on an IV. So I had lots of time on my hands to play with slides, read logos. I had all the ideas I was sending you. I'm like, clearly the universe needs for me to sit for 3 days. And off I went. And I was so grateful to our FSM Hive for ideas of, was she deficient? Is she stressed? She was just getting over a cold. She also got the bottom half of her braces off 2 days before. So
That
the urgent care doctor had seen that in her chart, and I wonder, was her mouth bleeding? Was something, when did they put the new retainer in? The mouth is like the fastest portal for.
when I get my teeth cleaned, because I've had both of my hips replaced and because I've had open heart surgery, I have to take 500 milligrams of amoxicillin 2 hours before I get my teeth cleaned. That's because the gums and the blood supply in the mouth, as Mary Ellen says, the mouth goes everywhere.
Right. And so that was the other thing that I was thinking about, was going from urgent care to the UCSF emergency department that they had called ahead to, and it was so funny. Went from urgent care, they like ushered us out this back door that led right to the parking lot. It was like, do not pass go, do not collect $200, go right to the emergency department right now. And the urgent care doctor, he was so young but enthusiastic that we go, and I said, listen, I understand the severity of this. This is why we're here. I go, I actually chose this urgent care because of the labs and the imaging. And he said, you need something faster than us. And I said, okay, good, done.
Got it.
Check. And he said, right away, I saw on her chart that she had her braces off. And I was thinking, wow, it's amazing how technology had linked her orthodontics to her. So at one press of a button, they could see everything. And her mouth was bleeding. They were really flossing and aggressively digging in there. And as soon as I thought of that, I thought of Dr. Chalmers talking about, and the first talk that I ever saw her give was on failed root canals. And so this was forever ago. And I almost didn't go. This was back when the advanced had 2 tracks, oral functional and practical or physical medicine. And thank goodness I gravitated to her talk, because she was talking about how mouth inflammation is everywhere. And if your mouth is inflamed or if there's an infection, you're just on a very basic level of energy. And Dr. Rob DiMartino talks about that term like energy deficit, right? All the time. If your body is busy fighting infection and inflammation in your mouth, then it doesn't have stores to fight it elsewhere. So that was the first thing I thought. It could have been a host of different things. She was just coming off of a normal virus, the mouth, whatever, just playing a hockey game, your tax, like who knows where the bacteria came from, but it was scary.
Do you know what her vitamin D levels are?
No, I don't think they had tested that on her. She just had routine blood work and everything was perfect. Her pediatrician is great. She said her ferritin was a little low, still in the normal range, but for an athlete, a young athlete, it should be much higher. So she was just starting to supplement with iron. But I'd be interesting to see what, and I'm sure it's low.
Well, vitamin D is not routine anymore.
No.
Insurance companies stop paying for it because it's low on everybody.
Except for me, thanks to Dr. Sosnowski, mine is apparently high and I should stop. But the functional medicine people are like, no, it's not high. It's where it should be.
Yeah, 60 to 90. If your vitamin D levels are between 60 and 90, your risk of heart disease and cancer goes down by 50%.
50.
50.
Wow.
Heart disease and cancer. And the risk of infection is low. So somebody who's had COVID 6 times, the first thing you test is vitamin D.
Mm-hmm.
And somebody with cellulitis from dirty hockey pads. And even if insurance doesn't cover it, it's the best $70 you'll ever spend.
Oh, absolutely.
But I'm so glad she's better. Those were scary pictures.
I know.
Although,
And I say that word loosely, bench that I got to sleep on for 3 days and it was great. It's not the Four
did they
Seasons.
give you a recliner? I thought you were in a recliner.
It was actually a bench that's built into the wall by the window. So it was enough for me to stretch out. But when I get, and maybe you can explain this, this was going to be one of my questions. When I am stressed, I get cold that I cannot warm up and I just start trembling. It did not chill to the bone.
Yep.
And it didn't help that I was confined to a hospital room where I couldn't, not only could I could not run for 3 days, but I couldn't barely move. My exercise was running down, getting a coffee at 6 a.m. and coming back up. So I think you had just texted. I was sitting there with like my winter jacket on and I asked the nurse for another blanket and I had my cashmere sweater on. I couldn't stay warm for 3 days.
Yeah.
It was, and then you're like, run concussion on yourself. I'm like, you're right. Enough about you, kid. Back to me now.
Yeah, exactly. You got to take care of the caregivers. And so every night, we just taught a core this last week.
Right.
And as soon as I get to the concussion protocol, run it on yourself at least 3 times a week, but at least every night. And it helps with the chill.
Yeah.
Carrie talks about people getting chilled.
Yes.
And yeah, what's up with that?
I don't know, but like the words, and this is actually a very interesting segue for us because ever since you would talk about Abrams and Van Gelder and all these osteopaths and the way that they speak, and we know how poetic, literally, some of the phrasing is. I have a special place in my heart for words. I love English. And maybe that's why I fell in love with FSM so much, because words are so important. And pattern recognition is so important. And so when I can use pattern recognition with words,
What's not to like?
Many years ago, when I put together the first frozen shoulder talk, I started gathering all this research because of using words like adhesive capsulitis and constriction in the capsule and congestion in the capsule. And I have a couple slides from Dr. Codman, who in 1934, he was a doctor that first came up with the term frozen shoulder and used the term adhesive capsulitis. So in Troutdale, the last sports course, I was talking about Dr. Codman like crazy because I researched him, and his descriptions of the shoulder are Shakespearean. So one of the practitioners found me. This was Codman's very first edition of the shoulder, rupture of the supraspinatus tendon and other in or about the subacromial bursa. His descriptions and pictures reads like a novel.
Hence the word Codman's exercises, the
Yes.
dangly ones where
The
you turn your
pendulum
shoulder
ones.
into a pendulum to
Yes.
stretch the capsule and give everybody room to breathe and bring circulation.
Yes.
Sweet.
So now that I have my grubby little hands on this, and I wish you all could smell it. It just smells like an old.
History.
Yes. Thank you so much to that person who's very special to send me the first edition of this book. But the language, one of the words that Dr. Codman keeps using over and over again is communication. How different structures communicate. And when they can't communicate, dysfunction arises. And I just thought, what a beautiful way of looking at what we do with frequency, because I feel like so many people will say, oh, it just feels like it flows together. I feel more connected. And maybe that's what part of cell signaling is all about, is the communication between cells. So from like a doctor who talks about his first Gray's Anatomy book, he talks about his copy is from 1867.
Wow. Communication.
Yeah.
Seeger's second paper talked about just the current increases cellular transduction.
That's communication.
Which I always think of as communication, transduction.
Right.
Like that's just the current increases the flow. And then Jerry Pollack is coming to the symposium.
Did he find his computer?
He must have figured it out because he said yes.
Oh, good.
No, I don't think he found it. Somebody stole it.
Oh, I'm glad that he said yes. And hopefully
He found a backup.
find something.
And if you think about his first book, which is what I asked him to talk about, Cells, Gels,
and
the Engines of Life, he talks about the fact that the cell has a matrix where all the water molecules are bound and they flicker, making every cell into a semiconductor. And then you graduate from that book to the fourth phase of water, where there's a linear flow of water or serum along the edge of the blood vessels. The water is organized. There's cellular transduction here, and the body conducts current and information in this organized field. It's why I have Jerry keep coming back.
yes.
So,
But what you just said, if I'm going to break down a definition of conduction, and you said another word, transduction, that's all part of communication.
yep.
Like you and I are communicating as we are transducing information through
Yep.
our two fields right now. I can't wait I just got my hands on it last night, and it reads like a novel. He talks about cases. He talks about, why aren't textbooks written like that anymore?
And the language they used in the 30s is like Harry's books and the medical books Abrams wrote in the teens, 20s, 30s. The language is very poetic.
It's
It's
beautiful.
quite different. Yeah.
Yes. The illustrations are like some hand scribblings. He's got photos in there. I just can't wait to put it into some slides to updo and you think about, we're all about like new information, new technology, there's space for going back and just not overcomplicating things. Like the structure of the glenohumeral joint has not changed in 100 years.
No.
We have the same ball and socket that we did 100 years ago.
We have the ability to image it with the MRI and ultrasound,
Right.
but the structure and the function is still the same.
And I think it's a lot of times, yes, imaging is fantastic and it definitely helps tell the whole story. But there's so many times where the imaging doesn't match the presentation for the good or for the bad. Sometimes somebody's in excruciating pain and their physical exam is horrible and their images are great. And sometimes their images are terrible and they're completely asymptomatic. So I think going back and just hearing his exam, like what he was doing in the exam and the presentation, and it's just, I think it's a lot more clinically relevant than reading an MRI report sometimes.
If you're brave enough, can you bring the book to Phoenix?
Okay.
Because that's the next time I'm going to see you. Oh, and you know what I did today?
What?
I went and picked the speaker awards.
Oh, I know you love doing that. It's like your Christmas shopping.
It's every year there's, let's see, we did that one before. That one's too big. This one's, this is just perfect. Yay.
And for those of you who don't maybe know, the speaker awards are not, and don't get me wrong, I love my plaques. I have 2 of them, but a lot of times you give a talk and you get
Piece of paper
that you probably wouldn't even frame. If they give you the cheap frame, maybe.
Sometimes they frame it in a little plastic $5 frame and you go, yeah, okay.
Thanks. Yeah.
But I want our awards to be special because I think our speakers are special.
And you can see in the background there, I have this beautiful vase too, like with glass. Like these are just things that are pieces of art, really.
And you've got the plaque that has Envoy on it. One year, I had them engrave the whole poem on the advanced for the advanced speakers. That was so cool. It's having a good time today.
It's like show and tell. Got to show and tell the horrific story my past 3 days and show some great things that I am.
And thank God for antibiotics. So
yes,
sometimes there are people that want to fix everything with FSM.
Yeah.
And to those people, I would like to say in all sincerity, there is a reason God invented Ancef and Augmentin and Olinia for parasites and mebendazole.
Yes.
And the reason is to keep you from getting dead. So I was on antibiotics for 6 years because of a jaw infection that ate through to the floor of my sinus. And I swear, people said, oh, aren't you worried about your microbiome? And it's every time I get a bacterial infection, it goes to my heart. And I end up in the OR. So no, my microbiome is going to be just fine. The infection is more dangerous than if my gut needs healing, I can give it butyrate directly. There's a thing.
I think we have to keep circumventing back to the word FSM is an amazing adjunct, right? And you've never said use this instead of that. We use FSM together with, right? I would never say use FSM instead of exercise or use FSM instead of manual therapy or mobilization some other way. What's beautiful about it is that it doesn't, so many people will ask, can I use it with this? I'm like, of course. Like when we were with a NHL locker room, it was used with 4 other modalities all at once, and it all works amazing together. So yes, we're treating my daughter, but I was very happy for the IV.
Yes. And I just put together a presentation for Katarzyna in Poland because she's going to a physical therapy conference and giving a lecture about FSM. And there's one slide that says Frequency-specific microcurrent is a tool that does something you didn't think was possible. That is a tool you didn't know you needed that does something you didn't think was possible.
Wow.
And it makes everything you do more efficient, more effective, less expensive.
Yeah.
And and yes, it makes everything you do with your hands and with exercise therapy possible. How do you exercise a muscle that's adhered to a nerve? How
Right.
do you exercise a muscle that has a partial thickness tendon tear? You don't.
How do you convince it that it's okay to contract when it's been offline for 20 years?
And you have a partial thickness tendon tear that you tore 5 weeks ago, and now you're going to try and strengthen that muscle, and there's still a partial thickness tendon tear, or there's the memory of a partial thickness tendon tear.
Right.
And the brain says, no, no, you can't exercise that muscle.
Yeah.
And it inhibits it. And we run 124 and 77. And we just came off a 5-day core. And as the practitioner says, the back of the shoulder, I said, feel that that little dip, run 124 and 77, and in 30 minutes, see what happens. And she said, it filled in. Am I hallucinating that? No.
Yeah.
Now try externally rotating the shoulder. Oh, it works.
Yeah.
Yeah.
Oh, that is like the best feeling. I love convincing did that just happen or am I feeling that right? I'm like, no, and that's what makes the in-person and practical weekends just such an exciting place of learning because you don't understand that when you're watching a lecture on Zoom, but when you're not only watching it happen, but when you're feeling it, I think all
Yeah.
those experiences just make you a better practitioner.
Yeah.
And
Yeah,
you had
exactly.
two very special people at the course. One of my favorite FSM practitioners from Calgary, Dr. Nenshi, was there. She's
Oh,
amazing.
yes.
I love her. And I
She's
think even
wonderful.
Dr. Burke was there, was he not?
And Dr. Burke was there. We had so much fun. And Alma and Dr. Burke were like brother and sister, and she took him off in the other room and did her. And it's a combination of FSM and muscle testing and kinesiology and things she's learned in acupuncture and things that she's learned in her neuroscience courses.
Yeah.
And she puts them all together, and it's like, how did you do that? And
She's
yeah, it's really fun.
she's the sister from another mister. I know she was, it's just, yeah, very amazing practitioner. Calgary, Alberta, Canada, you are lucky to have Dr. Nenshi there.
Should we answer
I
questions?
was just about to say, I've got the halfway alarm going. So let's find them.
Here,
Uh,
have any answer to this question in the webinar, blah, blah, blah. Any reports of individuals who claim they are sensitive to EMFs and report a negative reaction to FSM, especially a lasting reaction. FSM is not EMF. Radio waves, cell phones, TV towers, those are what we think of as EMFs. FSM is not EMF. So the lasting negative reaction is probably because you didn't do a vestibular screen on them. It has come up in this class. We had 16 people in this class. Half the class, 7 people, had BIVS scores over 30.
how many?
Half.
Wow.
7 out of 15, which is almost half.
Yeah.
And we did tuning fork exam on some of them. We did fields of gaze, but I just passed the BIVSS out to the whole class. And there were 41, 44, 56, 32, 26. The lowest score we had was 26. And they all had classic symptoms. None of them had prism glass. One of them had prism glasses, but they were made wrong. We had wicked wind coming down the gorge, beautiful sunshine. The outside temperature was 34, but it feels like 20 because of the wind chill. The negative reaction to FSM, especially if it's lasting, usually comes from using the concussion protocol, which makes sense unless you have a vestibular injury. So patients that think they're sensitive to EMFs, I hate to be the world's worst skeptic, but we are engulfed. There's 1,200 plus cell phone towers within a mile of my house. There is no place where I am not surrounded by EMFs. And that's different than having the head of your bed in between a wall that has wires coming into the wall and you're surrounded by 60 cycle wall current and the magnetic field that goes with it. These are people that have symptoms that they ascribe or have been told are due to EMFs. And it's like any other diagnosis that people walk in with. What else could it be? So you check for concussion, you check the BIVS, you check for brain injuries, you check their vitamin D levels. So what are the symptoms from EMFs? Brain fog, anxiety, depression. That's the vagus. Has anybody checked them for dental infections? Has anybody asked them when they got vaccinated? Has anybody asked them when did they get COVID? Has anybody asked them about head injuries? It's really easy to say that my symptoms are from something I can't escape and I can't get over, therefore I'm screwed. No, it's there. Look for something else. And the lasting reaction, the only negative reaction I know about is polarizing the spinal cord will give you pain in between your shoulder blades and a headache that'll last 2 or 3 days. But when you run on somebody that has inner ear injury, it can last weeks, nausea, disequilibrium, that sort of thing. Okay, you want to take Suzanne's?
Question concerns treating burn survivors. Are there any differences how you would use frequencies with atrophic, hypertrophic, and keloid burn scars? Are there any of these scar tissues contraindicated for FSM? Are there any special consideration settings for these? I believe you have a section of burn in the core, do you not?
So atrophic scars are where the skin just got eaten away and the muscle tissue underneath is gone. That's called a full thickness, 3rd-degree burn. They tend to fill in with connective tissue, or they've had skin grafts and they take skin off like the thigh or the back and they graft it onto the arm so it's thicker. It's a different kind of skin, and grafts scar in a very particular way. So the 58s, 13, and they get hard. And when you think of 13, you have to think in layers. You're not going to get the skin to look normal. Your goal is to improve range of motion. So what creates range of motion? Scarring in the connective tissue, scarring in the blood supply, the capillaries, and especially scarring in the nerve, and even skin grafts have or collect subcutaneous fat. So sclerosis in the adipose is the thing, but scarring in the nerves, sometimes with full thickness burns, the nerve gets trapped in scar tissue. And I was sitting with a patient with the the head of the burn unit at Mercy St. John's Mercy St. John's in Springfield. And there was this quarter-sized burn on this guy's arm. And I'm sitting there working on the scar tissue, and I said, "What makes this itch?" And he said, "Oh, it's central." And I went, "Okay." So the patient's up reading a newspaper and talking to us and listening to us. And I ran, when he said it's central, I ran 40 and 89. And the patient fell asleep. And the doc said, "Did you do that?" I went, "Yeah." "How did you do that?" "I treated the frequency for central sensitization." So it's basically a thalamic representation for this much skin on his arm. And I said, "Do you want him to wake up?" And he said, "Yeah." "Can you do that?" And I went, so I ran 49 and 90 and 6.8 and 38. And he went, blink. And the doctor looked at me like I was a witch. And I said, just raised my eyebrows, and I went back to 40 and 89, and the patient fell asleep again. He said, "That's weird." And it's what happens when you treat the right thing with the right thing.
Right.
But we couldn't fix it because you can't run 40 and 89 all the time. But treating burn scars are really easy.
Yeah.
You just have to tell the patient ahead of time, your skin's not going to look normal, but you're going to be able to move it. And
Right.
it may or may not be a one visit fix. So that's pretty cool.
And nothing contraindicated, right?
No contraindications, really, not any that I've seen. And we've seen 80% full thickness burns with the foot stuck at 90 degrees because he was standing up and wearing sneakers and all of his clothes caught fire. The only thing that wasn't burned was his face and his hands. It was in Taiwan. He had fireworks went off and caught all his clothes on fire. It was a thing. And then there was the burn study
Right.
in
Right.
Springfield. That was amazing.
Right.
Um,
I think for the most part, we see burn cases many years after scarring has set in, and I found it's extremely beneficial for manual therapy. It makes the scar just so much more pliable.
Oh, the other thing is 217 and 91, the skin gets hard. And I don't know the mechanism, but I know that 91 and 217 work
On
really
a
well.
right, yes.
Yeah.
Yes. And my old friend 49 and 142, the vitality to the fascia afterwards and increasing the secretions to you're never going to go wrong with running that in traumatized.
Well, you have to finish with that.
Yes.
Yeah. It's like you take out the bad stuff, put in the good stuff.
Although I do talk about it the Sports Advanced when you can put in the good before taking out the bad, but that's the thing.
Take your choice.
Yeah.
Well, see what works. That's the take home message is
Yeah.
do it and see what happens.
Right.
It's the response to FSM is what teaches you what really works.
Yes.
And you learn by doing it.
Yeah. And your objective outcome. So yes, we feel for smush and we want to have that increased thixotropic change of fascial response. Range of motion is your objective finding. So when you're not sure if it's smushing, retest with range of motion, and that will also tell you very quickly when you're unsure. And then you can document that and you could write a case report. Just saying.
Presented at the symposium.
Just saying.
There's 12 of them. The whole afternoon. The morning are the plenary speakers on both days.
Yep.
Juliana Mortensen and the other one. And then Christy Hughes on Saturday and Jerry Pollock and no, I didn't bring the schedule up. And then the afternoon is all case reports. And it's the case reports where we learn so much. And it's the case reports that turn into published papers. Oh my God. Walter Gregory finally feels better, whatever. We got the Scleroderma paper finished,
Wow.
and he's given it to Francesco. And there is a Scleroderma journal that's specific to scleroderma. Walter always pushes the boundaries. So we have all the published stuff that creates the background for what we did. He found in the subsequent cases that he did that their Raynaud's got better.
Wow.
And so he took Roger Billica's unpublished cases and put that presentation in. So now it's going, if it gets accepted, it's going to be published as part of the Scleroderma paper. Roger presented that in teen. And I said, can I publish it? And he said, absolutely. That was 11 years ago. And I still haven't published it. And Walter just found out that it worked. And then Dave Burke found out that using 81 and 62 and vitality in the arteries just made the hands go from white in Raynaud's to pink and warm, like in minutes.
Wow. I'm going to try that next time I go to Costco, because it happens to me every time I go to Costco.
You get Raynaud's?
Yeah. I
Oh.
have it. I've had it, but it's something about the shopping carts and the heights and the coolness of, and maybe just the stress of people with vestibular injuries going into Costco. That it's a thing. Yeah.
And there's a whole protocol after talking to Christy Hughes, and this part of her lecture, it's why she's in the symposium instead of the advanced, is the changes that they know about that happen on the inside of the blood vessels after COVID. So COVID, the virus, goes into the ACE2 receptors in the blood supply, and when they come boiling out, they just trash the endothelium. She's got a really good illustration of what the endothelium looks like when it's been trashed, and then what it's like to rebuild it. The protocol we wrote for vascular health is torn and broken by reducing inflammation, increase secretions, because the endothelium secretes the lining that makes it smooth,
Right.
and then vitality. And you run all those for 2 to 4 minutes a piece. And it finally got my heart rate variability back up.
Wow.
Running that.
Wow.
Yeah. That's like my heart rate variability since we got back from Poland and Rome has been in the teens, and it used to be in the 30s and 40s. And it's come on. It's not just concussion in Vegas. What happened? And I didn't get COVID. I didn't get sick. But when 2 weeks ago, when I added vascular health, it popped back up into at least the high 20s, which was nice. Good.
What was I going to ask about?
Jillian Bennett, not a question, but wish everybody a happy holidays. Happy holidays, everybody. And thank you to Dr. Carolyn Kim for all of her knowledge and guidance this past year. With my introduction to FSM, it has changed my life with an Ehlers-Danlos diagnosis and my husband's 20 years of chronic pain. Thank you.
Oh, the other thing was we had a note here from Janet Eng, who, when we were talking about my daughter's cellulitis and bursitis, she had written, just a thought, adrenals get stressed, occurs when working night shift at 2 a.m. with cortisol. Would adrenal support have been helpful?
Well, cortisol reduces inflammation. I guess the question is, what is the effect of cortisol on the immune system? I don't know. Can't hurt. Might help. And
Yeah.
I don't know. If you look at the patient, how old is your daughter?
She'll be 15.
15. So she's 14, 15, playing hockey.
Oh, me and my shivering.
Yeah, Kim and shivering.
Oh,
That's a thought.
maybe.
Yeah, there's that. And elevated cortisol interferes with the conversion of the storage form T4 to the active form of T3. So when your stress levels go up, as they might when you think your daughter is 2 steps away from sepsis and going to visit her grandmother, that would make you chilled. Your thyroid went down. You weren't getting any exercise to raise your activity level. I used to get really cold every 2 a.m. when working the night shift and get chills and couldn't get warm, and with stress cases at night.
Yeah.
Elevated cortisol.
From an ER doc, everybody. So she
Yeah.
understands.
It was so wonderful to have Jenna Dang here in October. That was great. She
Yes.
came to the 2-day and then she went to your 3-day class, right?
Yeah. Yeah.
That's excellent.
Yeah. It was such a small class, but those small classes are magical. There's just so much collaboration and storytelling. So it almost turns into a master class of, I'm like, okay, guys, I have to get through these slides, but
Yes.
we're still going to talk about this stuff.
It makes the practicum so wonderful because you have extra time. You have
Yeah.
fewer tables to get to.
Yeah.
And the people really do a deep dive into, literally, into the patient's abdomen or shoulder or elbow or hip.
Yes.
And
Yeah. I think we have one more question. Non-cancerous cyst on the tail of the pancreas may or may not have been the result of trauma, was drained, has refilled about 7 centimeters in diameter. Basics, of course. Could you talk about cyst frequencies? Any other ideas?
okay, when I got to the cyst frequencies for cystic condition, I had to tell this class, I haven't found anything they're good for. I've used them on breast cysts, I used them on ovarian cysts. They don't do anything. They don't change anything in real time. So maybe they change the tendency to create cysts. That's a possibility. That's the thing. But they don't do anything. Cysts are the result. The breast cysts have been the most impressive, and ovarian cysts. So you run 40 in the ovary and you turn a cyst from the size of an orange and a little water balloon to the size of an ovary, about a centimeter. And that's just running 40.
Right.
Breast cyst, 7 centimeters, ultrasounded. They measured it. They let me go into the treatment room, treat the patient, and from palpation, the thing that made the cyst shrink the most were the 3 frequencies for toxicity, but mostly the frequency for inflammation. And the ultrasound that was done 30 minutes after the first ultrasound showed a 25% shrinkage in the cyst. Treat the tail of the pancreas for inflammation. Cancer is inflammatory. I would increase the patient's intake of methylfolate, and assuming they can demethylate B12, methyl B12, because methyl groups, when the DNA breaks, methyl groups stick on the end of the DNA and prevent it from turning into abnormal DNA that you find in a cancerous situation.
Right.
So 7 centimeters is huge. The tail of the pancreas is that big. So that cyst tripled the size of the tail of the pancreas, or maybe double it. They drained it and it refilled. That's huge. Basics, of course, in the pancreas, not the islets. Check the pancreatic enzymes. Are they making amylase? Are they making lipase? What's their insulin levels? So what effect is this cyst having on the function of the pancreas? Is the rest of the pancreas taking over the job? I have all these curiosities. It's like,
But those questions are what prompts the hypotheses, and you have to start asking questions. And my favorite, most simplistic one is, how did it get there? How are we here? Why are we here? When did we get here?
May or may not have been the result of trauma. What trauma? The pancreas is buried. It's behind the stomach. It's next to the liver. How do you traumatize, especially the tail of the pancreas? Pretty sure it's behind the stomach. How do you traumatize the pancreas? Did the patient have a gastric bypass surgery? A rubber band put on her stomach and they oopsed and hit the pancreas?
Trauma. We have a frequency for that.
True. I would treat.
The alarm. 4 o'clock alarm. It's the saddest alarm of the week.
8 millimeters?
What are you reading?
Maria's question, what do you suggest for nodules that have appeared on the index finger of the right hand? Tender to touch when they're pushed on, and they're 8 millimeters. That's almost a centimeter. That's a lump. That past nodule about 3 millimeters ago. It's overuse. It's called, starts with a B. What is that called? The little bumps on the end of the fingers. Janet, what are those called? Come on. Somebody help me out here.
Well, Carol's waiting for or Janet was just thinking, she said. So when you guys can Google it very fast, while everybody's been subscribing who gets the FSM and Precision Distributing News, you have a couple weeks to get your devices because they have the big end of the year sale. So now is the time to give Christmas presents or your Christmas list.
Or make your accountant very happy by buying this stuff at the end of the year that you can write off. I actually got a letter from my accountant saying, go buy stuff that is deductible. And it's his fault. I bought a new desktop computer yesterday. Heberden's nodes. Thank you.
What are they?
I knew it had a B in it.
Oh.
And it's a combination between periosteum and the tendon and the joint capsule.
Right.
And it gets inflamed, calcified. The synovial fluid gets hard. Yeah. So you treat the synovium for hardening and the capsule for hardening and hope for the best.
It's 4 o'clock.
4:04. Oh, there you go. Oh, thank you, Leaf. We will have a happy holiday. And then
we're back next week.
It's not Christmas Eve.
No, that will be the 18th. So we'll have one more this year. Yes.
We have one more week.
So okay. I will see you next week. Thanks for letting me share my story, my debriefment.
Oh, it was a good learning experience for the daughter, you, and everybody listening.
And a source of gratitude for all the extra knowledge that you get to hold on to that doesn't just go in, cellulitis and out the other. It's, oh no, this is
a real thing.
Here we go. Yeah.
Yeah. It's passing that knowledge along from within our group to the huge group that has become FSM. That is just my favorite part.
Mine too. Yay. And talking with you.
Okay.
Yes. Thank you. Me too. All right, everybody.
Okay.
Yes. Thank you. And we'll see you next week.
See you next week.
Bye.
Bye.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts, or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.